Welcoming you all to my new channel, The Anatomy Untangled. I hope this channel brings you all the information in a very simplified manner. If you find the videos useful, you can click on the bell icon for instant notifications. Without any further delay, let's get into the video. In today's video, we will be discussing about the middle cranial fossa. So before moving on to it, let's have a brief discussion about the previous session. So here is a skull and I remove the vault portion of the skull and look into the interior portion of base of skull. So I have already dealt with anterior cranial fossa and I will mention the link in the description box. For the middle cranial fossa, there are two boundaries, the anterior boundary and the posterior boundary. So the anterior boundary is formed by the posterior border of lesser wing of sphenoid. And the posterior boundary is the superior border of petrous part of temporal bone. There is a bony ridge that is present and it's called tuberculum sellae, and lateral to it the middle clinoid process is attached. Okay, so there is an optic canal that is formed by the greater and lesser wing of sphenoid, and then there is an depression called fossa, which is a pituitary fossa where pituitary gland is lodged. And all the three structures here looks like a Turkish saddle, so they together called as sella turcica. The part I am drawing now is the parietal bone. Since it's a paired bone, let's draw it on the other side too. Yes. This portion is the squamous part of the temporal bone. This is the apex part of the petrous part of temporal bone. Foramens present in the greater wing of sphenoid. The first foramen is the foramen rotundum, and lateral to it is the foramen ovale because it looks like oval in shape. The third foramen, which is the most lateral part, is the foramen spinosum. This foramen is known as the foramen lacerum. In the anterior surface of petrous part of temporal bone, the first one is the fossa for trigeminal ganglion, also known as cavum trigeminale. The second one is the arcuate eminence, and the third one is the tegmen tympani. The structures passing through the foramens will be dealt in a separate video. If you have any doubts related to this topic, you can give it under the comment section and it will be answered really soon. Until then, it's bye from us.